Let's remember to exercise regularly. The benefits are beyond doubt. There is a general agreement in all the studies that our modern sedentary lifestyles have much to answer in the etiology of obesity, metabolic syndrome, insulin resistance, diabetes mellitus, cardiovascular diseases, peripheral vascular diseases, and all vascular and endothelial dysfunction. There is an important role for exercise in the management of overweight combined with dietary control. It is important to remember to exercise regularly. After initiation of exercise, the energy requirements increase immediately, increasing the metabolic rate. So, the exercise must be maintained lest the metabolic rate will drop. The metabolic rate drops, again there will be gain in weight. So, exercise program has to be continued on a regular basis. These are some of the visible and invisible benefits of exercise. Combined physical activity with properly chosen diet, regular physical over a period of time result in improvements in the body fat content, visceral fat, and the physical appearance of the individual. Internally, there will be increase in the HDL cholesterol, there will be decrease in the LDL, there will be decrease in the triglyceride, there will be decrease in the glycemia, there will be decrease in the fat content of the liver, there will be improvement in the NASH and in the NFALD. So friends, we have come to the end of this presentation, and let us recapitulate. Let us come back to whatever we have seen in this presentation. Fatty liver, non-alcoholic fatty liver disease, NASH. These are the main cause of elevated liver enzymes. They are not benign. Remember, they are not benign. This fatty liver disease is not one disease. It is a continuous spectrum starting from steatosis to steatohepatitis, cirrhosis, and then hepatic cell carcinoma or HCC. Some cases of cirrhosis do end up with hepatocellular carcinoma. So, the steatosis or NAFLD is the first stage, NASH or the non-alcoholic steatohepatitis with inflammation and fibrosis is the second stage, complete fibrosis and scarring with portal hypertension is the third stage of cirrhosis, some of them ending in hepatocellular cancer. So, if we intervene here, we can prevent the occurrence of the end stage decompensated liver disease. Insulin resistance, metabolic syndrome are the key pathogenic components for anyone to develop fatty liver disease. Diabetes mellitus, hypertriglyceridemia, non-fatty abdominal obesity, increasing age are important risk factors one has to keep in mind while evaluating any patient. If we confront with patients of diabetes, hypertriglyceridemia, abdominal obesity, insulin resistance, metabolic syndrome, we must evaluate them for NASH and NAFLD. The other hand, if we see NASH or NAFLD or fatty liver, we must look for these diseases. Remember, NASH and NAFLD are not benign. They are the markers of CV risk. Treatment improves the insulin sensitivity and thus reduces the CV risk. So, modify the underlying metabolic risk factors by two important interventions like the appropriately chosen diet and regular exercise program. I advise all of you and encourage you to use Mayo scoring, which is very simple, using the clinical biochemical parameters which we normally obtain to predict the fibrosis. Liver biopsy is generally not required. With these messages, I conclude this CME on fatty liver and its manifestations. I hope you have been enlightened and elucidated about this particular important problem which we commonly ignore and which we commonly fail to investigate and evaluate. So thank you all very much, and the next slide shows our future program. The following are our next CME programs. I am talking on dyspepsia at Teja Hospital, Ambattur on 28 June, which is a Sunday, and the program starts at 6:30 p.m. followed by dinner. Those of you who have not heard to my dyspepsia presentation earlier, I request you to come and use the opportunity to participate in that CME on dyspepsia. Of course, in the same venue where we have met today, that is the Kemcherin Hospital, Mugaper, we are going to have the next regular CME of ours on the third Sunday of July, which is 19th, and the subject matter will be renal stone disease. Till then, good luck and goodbye. Thank you all.